Yoga as Therapy for Back Care, Part 2. From Constructive Rest, draw your knees back into your chest. Draw the right knee in as you slowly extend your left leg out. On an inhalation, switch legs. And on an exhalation, draw the left knee in, stretching the right leg out. Inhale, switch. Exhale, draw the right knee in. Inhale, switch. Exhale, draw the left knee in. And then bring both knees in. Bring your knees away from your torso so they're about at a right angle. And you can lift your lower legs up so that it's a series of right angles here. And then you're going to inhale, bring your arms up and overhead as you slowly extend the right leg out. Exhale that leg back in, arms come to your sides. And as you do this, you want to keep your lower back engaged into the floor, your lower belly drawn in and up. So inhale, left leg extends out, arms come up and overhead. Exhale, that knee back up, arms to your sides. Inhale, right leg. Exhale, bring it back. And after you've done this a couple times, if you feel able to do a little bit more, you can bring your legs up in the air. And then as you inhale, your arms up and overhead, extend your right leg out. Again, keeping that lower back engaged. Exhale the leg up, arms to your sides. Left leg extends as your arms come up and overhead. Exhale, bring it back up. You can continue like that. The next step, which there's no rush in achieving it, would be to extend both legs, but only if you can continue to keep that lower back engaged into the floor. Inhale away and exhale back up. And one more time if you're able. And then hug your knees into your chest. If your lower back is talking to you at all, that means that you went a little bit too far into one of those lower abdominal strengtheners, and you want to pull back a little bit next time. And then the next thing you want to do is bring both legs out once more to the series of right angles. Lower the left leg down, bring your hands behind the right thigh, and we're going to pull the thigh towards us as we pull away. It's an isometric exercise, so nothing's actually moving, but the muscles are engaged. And on an exhalation, we're going to curl up and bring the forehead towards the knee. But the movement needs to start at the pelvic floor. So it's an engagement of the pelvic floor, in and up on the lower belly, curling up, tucking the chin so that everything rolls up. And it's very important that when you lift your head up, you do it in this way, tucking the chin as opposed to lifting straight up, because that's going to cause, if you lift straight up, it's going to cause a lot of tension in the back of your neck. So again, hands on the back of the thigh, drawing it towards you as you pull it away. On an exhalation, engage the pelvic floor, your lower belly, squeezing your belly in and up, chin comes to your chest, and then come back down. Exhale, curl up like a potato bug or a caterpillar. Inhale, back down. Exhale, curl up. You can hold here. You can extend your arms if it feels comfortable, if you can breathe and not strain anything. And then come down slowly, hugging that knee into your chest. And then we'll switch legs. Lift the left leg up, hold on behind that thigh, draw your shoulders back and down. And doing crunches in this way allows you to become aware of the order of engagement of the muscles that's important for a healthy spine, and it rewires your neuromuscular patterns so that those muscles wire in the correct order when you're doing some kind of abdominal exercise more quickly. So holding on behind the thigh, draw it towards you, draw the thigh away, inhale deeply. As you exhale, lift up on the pelvic floor, in and up on your lower belly, chin to your chest, squeezing everything in, and then inhale back down. Exhale, curl up. Inhale down. Exhale, curl up, maybe hold. Extend your arms, breathe deeply. And when you're ready, come down slowly, drawing your left knee in and then your right. And then release your feet to the floor. And we're going to roll over onto our stomachs. We just strengthened the abdominal muscles, and now we want to strengthen the back muscles so that those two work together to support your back. Begin with your forehead on the floor, your legs extended. Lift one at a time and reach back to create a little space in your hip joints. Engage the tops of your feet gently into the floor, your pelvis. If you're able to, bring your palms together behind your back and squeeze your shoulder blades together. Lengthen your spine, and if you're not able to do it in this way, you can bring your hands to the floor instead with your palms down. Either way, you're going to draw your shoulder blades together down your back. Inhale, lengthen your spine, and then lift your head and chest up, looking straight ahead if you're able. Exhale, back down. Come up and down with your breath. And the next time that you come up, hold the posture, breathing slowly and deeply. As you inhale, bring your awareness up your spine, lengthening it. As you exhale, bring your awareness down your spine, down your legs, and out the soles of your feet. And on your next exhalation, come down, resting on one cheek. Release your arms and let the whole weight of your body drop into the floor. If there's any tension in your lower back, you can rock your hips a little bit to release it. And then bring your forehead back to the mat. Bring your hands to either side of your chest. You want to draw the shoulders back and down in the same way that you did in the previous pose. This time you're going to lift the legs as well. Lengthen your spine from the inside and then lift your head and chest up and your legs looking straight ahead. Exhale down. Try to keep your legs straight so that as you inhale and lift up, you're lifting the front of your thighs up off the mat. Exhale down. If this tweaks or bothers your lower back at all, then come back to just lifting the head and chest and not the legs for now. And the next time you come up, you can hold. You can stay here, or you can bring your arms out like airplane wings, breathing slowly and deeply. Over time, maybe you can sweep your arms out in front of you with your palms together. This causes a lot more weight on your lower back, so be mindful. Breathing deeply. And when you're ready, on an exhalation, come down, rest on the opposite cheek as before. Let your shoulders relax forward. Let everything drop into the floor. Inhale, find the tension. Exhale and breathe it out. Bring your forehead back to the mat, your hands to either side of your chest. Lengthen your spine, lift your head and chest up, and then slide your arms forward, bringing your elbows under your shoulders. You're going to pull back with your forearms to lengthen your spine. As you exhale, let your breastplate just soften forward and down as your shoulders come back. And you want to feel this back bend in your mid or upper back. So if you feel it solely in your lower back, then slide your arms forward. Again, lengthen your spine and soften your heart forward and down. You should feel that back bend move up your back. And you want to feel it, like I said, in your upper or mid back. Once you find the back bend that's right for you, close your eyes, bring your awareness to your breath. Inhale, find the tension. Exhale, breathe it out. And find that balance between equal effort and ease, relaxing as much as possible, even within the effort of the pose. And on an exhalation, come down, resting your forehead on the back of your hands. And you can rock your head from side to side, massaging your forehead. And rest in this position, noticing how you're able to breathe deeply into your rib cage, expanding your lungs in all directions. And notice your belly as it pushes into the earth on the inhalation, and how your whole body drops towards the earth as you exhale. Now bring your hands back to either side of your chest. Inhale slowly up to hands and knees. Bring your knees under your hips, your hands under your shoulders. Spread your fingers nice and wide, but then bring your thumbs back in slightly. And imagine you're going to try to take a chunk of earth out of the floor with your hands. So you're really gripping with your fingers. Don't lock the elbows, lengthen your spine. On an inhalation, you're going to tilt your pelvis forward, draw your shoulders back, look up. And on an exhalation, draw your lower belly in and up and bring your chin to your chest. Inhale, lengthen and arch your spine. Exhale and round. Inhale, lengthen and arch. Close your eyes and feel your spine moving in space. Imagine that it's seaweed floating in the waves. You want it to be a really fluid, graceful movement. And then come back to neutral. You're going to look over your left shoulder, drawing your left hip and your left shoulder towards each other. Inhale back to center. Exhale, look over your right shoulder. Inhale back to center. Exhale, look over your left shoulder, moving the spine laterally from side to side. And then come back to neutral and exhale into child's pose. Bring your bottom towards your heels. Push into the floor with your hands to anchor your bottom there. And then you can pull on the mat to create traction in your spine, lengthening your spine. And on an exhalation, relax your forehead to the floor. Bend your elbows out to the side so your shoulders can relax. And then bring your awareness and your breath to the back of your body, expanding it like a balloon. Exhale and breathe it out. Rest here, noticing the effects of your practice on your body, your breath, and the state of your mind.